Welcome to The Explainer. Today, we are tackling one of the toughest, most delicate moments in all of clinical practice. It's that conversation. You know the one, where a patient is looking to you for answers and you're just not sure what's causing their symptoms. We're going to break down a systematic review that gives you the tools to turn these really challenging moments into powerful opportunities to build trust. Okay, let's just dive right in. Picture this. Your patient is sitting right there in front of you. They're looking for answers. They're probably worried, maybe even a little frustrated. And the honest to goodness truth is, you don't have a clear-cut diagnosis for them yet. And look, this isn't some rare thing, right? This is a core part of medicine. So what you say next, man, it's way more than just a conversation. It is a make or break clinical skill. So, okay, before we get into the how-to, we've got to get on the same page about the what and the why. What are we really talking about when we say diagnostic uncertainty? And why is getting this conversation right so absolutely critical, not just for building trust, but for patient safety itself? Okay, so first things first, let's get a clear definition on the table. And the key word here, you gotta notice this, is subjective. This isn't about some universal truth, it's about the clinician's own perception that they can't confidently explain the problem right here, right now. This isn't you saying, I'm not good at my job. No way. It's just being honest that, hey, in medicine, we don't always have the answer right away. Okay, and this slide, this is where things get really interesting because it draws a super important line in the sand. Diagnostic uncertainty, well, that's just part of the gig. It's inevitable, it's going to happen. A diagnostic error, on the other hand, that's a failure in the process. Now, that could be a failure to find the right diagnosis, sure, but, and this is the part we're focusing on, it can also be a failure to communicate what's going on, even the uncertainty itself, to your patient. And if you're sitting there thinking, man, this feels like it happens all the time, you are not wrong. The data totally backs you up. Just let that number sink in for a second. Up to a third of all symptoms that walk into a primary care clinic might never get a final, neat and tidy explanation. So this isn't some rare event. It's a fundamental reality of what we do, which means getting the communication right around this stuff, it's absolutely non-negotiable. All right, so we've established this is a huge common challenge. The big question is, what are clinicians actually doing about it? Let's dig in and see what the research found, how it breaks down all the different strategies and, the actual words people are using when they're in this exact spot. So the research basically splits the approaches clinicians take into two big buckets. First up, you've got your patient-centered approach. This is all about the human side of things. Empathy, reassurance, managing their expectations. And then there's diagnostic reasoning. This is where you kind of pull back the curtain and let the patient in on your thought process. You're basically thinking out loud with them, walking them through what you're considering and what you're ruling out. And when you look at the actual words people use, it tends to fall into one of three camps. You can be super direct, right? That's explicit disclosure, just flat out saying, I don't know. Or you can use implicit disclosure, softer language, kind of hedging your bets with words like, it could be, or this seems like. And finally, there's omission. Basically, you just don't mention the uncertainty at all. And as we're about to see, each of these choices lands very, very differently. So yeah, this all leads to the big million-dollar question, right? Which one of these actually works best? Is it better to just be brutally honest? Or does that scare patients off? And you're about to see, the answer is, well, it's complicated. The way this stuff affects patients is really complex. And honestly, it's often not what you'd think. Okay, this brings us to what is, in my opinion, the most important part of this whole thing, the patient's experience. Let's flip the script and look at this from their side of the table for a minute. How does this stuff actually feel to them? How do these different ways of talking shape whether they trust you, whether they feel heard, and whether they're confident in their care? Man, this table says it all. It really shows just how tricky this can be. Okay, look at explicit disclosure. Just saying, I don't know, by itself, it can actually tank a patient's trust. They might think you don't know what you're doing. But, and this is wild, you pair that exact same phrase with a bit of empathy, and suddenly the complete opposite happens. Trust can actually go up. Same thing with explaining your reasoning. It's great for showing you're competent, but if you rule out all the scary stuff and then just say, we'll see you later, you can leave patients feeling totally frustrated and dismissed. So if there's one thing you take away today, it's this. Just being honest is not enough. The magic, the real connection, it happens in the combination. The phrase, I don't know, only becomes a trust-building tool when you follow it up with, but here's what I am thinking. Here's what we're going to do next. And I totally get that this is frustrating for you. And we really have to remember the psychology that's going on here. A diagnosis, it's not just some clinical label on a chart. For the patient, it's validation. It legitimizes their experience. It's a permission slip to be in the sick role. So when we can't give them that label, it can feel like we're basically dismissing their experience, or worse, questioning if it's even real. And that's why that empathy piece is so non-negotiable. All right, we've gone through the theory, we've looked at the evidence. Now for the part that really matters. How do we take all of this and actually use it? How do we build a better conversation in our very next appointment? Let's get practical and put this all together. Okay, so the biggest take-home message from this whole review really boils down to this powerful two-step combo. Step 1, open up your brain a little. Be transparent about your reasoning. Let them in on what you're thinking. Step 2, you got to wrap that whole clinical explanation in a warm blanket of patient-centered communication. Listen, reassure, acknowledge their feelings. It's not one or the other. It's the clinical brain and the human heart working together. That's what works. So what does that actually look like in practice? Well, here you go. Think of this as your take-home checklist. Share your thinking. Don't be afraid to name the scary stuff you're ruling out. It shows them you're hearing their biggest fears. Acknowledge how they're feeling. And this one is huge. Use safety netting. And I don't just mean come back in 6 weeks. I mean a clear, concrete plan. Here's what to watch for. If this happens, call us immediately. You're giving them back a sense of control when they feel like they have none. Look, this approach is good for any clinician, but it is absolutely vital when you're dealing with those conditions that just don't fit neatly into a box. For all the physiotherapists out there, think about it. Chronic nonspecific back pain, persistent dizziness, chronic fatigue, these are conditions where a clear diagnostic label might never be on the table. In those cases, this communication model isn't just a nice to have. It is the treatment. It's the core of how you build that long-term therapeutic alliance. And that right there, that gets to the heart of the whole thing. It's a total paradigm shift. We need to stop seeing a moment of uncertainty as a failure on our part and start seeing it as an opportunity to build a stronger relationship with our patient. It's basically an invitation to say, hey, I don't have the answer right now, but we're going to figure this out together. And that can be more powerful than any diagnosis you could ever give. So I want to leave you with this question to chew on. The next time you're in that situation and you feel that uncertainty creeping in, how are you going to flip the script? How are you going to turn that moment of doubt into an opportunity to build a rock-solid partnership with your patient? Something to really think about. Thanks for joining us on The Explainer.